with us. I just want to give a brief report today on the progress in opening our parks this week. Since Tuesday, we've seen pretty good number of people recreating in our parks. Our rangers are out and reporting that in almost every case, people have been practicing social distancing, some wearing face masks, and the parking lots aren't overly crowded, so things are going well there. The reported mood is good also. So we know in the next few days we're going to have some really warm, nice weather. So I'm asking again that everybody plan ahead, don't jam in our parks. If there's a crowded parking lot, go somewhere else. Maintain social distancing, and please look out for each other, look after each other. We don't want to have to dial back restrictions in our parks, and we're relying on everyone in our community to be responsible. Lives literally depend on it. So thank you for your cooperation, doing a great job, keep it up. We have had some people express concern about people becoming either social distancing or mask enforcers. I know people feel really strongly one way or another, but as a community, particularly going through a pandemic, we need to remember that everyone responds a little differently to the stress and uncertainty and has different opinions on matters. So we want everyone to be safe and healthy, and that key part of that really means not trying to incite conflict. So if you find yourself in a situation where someone is deliberately ignoring steps to keep others healthy, we just ask you keep your distance and don't try to become an enforcer. Just as distance is a powerful tool for reducing the spread of the illness, it's also a powerful tool for reducing conflict. So keep your distance and keep yourself safe. So we're all eager to get back to a more normal routine with work, school, religious gatherings, sports, and recreational activities. That is starting up. But the fastest way to do so safely is to follow the health measures, practice social distancing with your loved ones and the members of the community, and just keep your community safe. So I'm grateful today that we have a veterinarian, Timothy Cavanagh, joining us today. Since all of us with pets have been concerned about reports that some pets may be infected with the coronavirus, Hewitt and I will both be listening closely, and I'd bring him up to the screen, but he's snoring at my feet, so he'll listen from afar and I'll fill him in later. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Great. Thanks, Executive Summers, and good morning, everyone. I just have some comments today about clearing up a few disturbing rumors about testing, giving you an overview of case investigation and contact tracing process, and a brief update on some data reporting and community-based testing going forward. First, just briefly, rumors about testing. We've, I think, picked up on social media concerns about coronavirus testing being a means by which the virus might be transmitted to the people being tested, either intentionally or accidentally. And so, just beyond general reassurances, I can't say much about, there's no intention of transmitting the disease through testing. That's our intent, both at the health district and throughout the healthcare community, is the opposite, to interrupt transmission. And remember that the items being used for the testing are sterilely packaged. The healthcare providers are in fresh personal protective equipment, trained in aseptic technique, and these swabs are clean and are not a means of accidental transmission of the virus to people. So just wanted to reassure you that. The other is, I think there might be some concern among a minority, but a significant minority of people, that by testing positive, they would be ordered to go to the isolation and quarantine facility at Angel of the Winds Arena. And I just want to reassure that the vast majority of individuals with COVID-19 are isolated in their homes. and just as their contacts are quarantined in their home. And we only resort to the isolation quarantine facility when an individual has no shelter, has no home to go to, or when they can't, due to the size of their home, they can't successfully separate themselves on a sustained basis from a vulnerable family member who's elderly or who has underlying conditions. And again, that's just a minority, a small minority of folks. So please don't let that dissuade you from seeking testing. And in either case, if you have a place or don't, we'll try to make sure you're taken care of if you're positive and need a place to stay. Moving on to after testing, when individuals are identified as a case, and then I just wanted to give a brief overview of what happens to the individual. Usually they're advised by their healthcare provider, and often now already know, given all the news that's surrounding us around this, is to stay home until they get their results. And then if their results are positive, we're going to ask people to stay home for at least 10 days total, and as well as a full 3 days after their fever has resolved, if they had one, and their cough or other respiratory symptoms have been improving for 3 days. So again, the formula, if you will, for liberation from isolation is 3 days of no fever, 3 days of improving symptoms, and at least 10 days since the illness started. So when the health district contacts someone, and sometimes we're also working with the state health department to do some of our case investigations. So individuals who test positive will get a call either from the Snohomish Health District or from our partner, the Washington State Department of Health, making sure they're aware of their results, reminding them about these isolation timelines, and then giving advice and providing written information about what they can do to prevent transmission to others while they're in isolation. Then we ask a series of questions that are useful for our contact investigation, as well as just our epidemiologic analysis of what's going on. So it's things like name, date of birth, address, what your job is, what your job duties are, other people whom you have close relations, either in your household or close friends or coworkers whom you spend a significant amount of time around, because those are individuals who are at risk from having acquired it from you. And so we then notify those people, and if they're essential workers and well, they can continue working with a mask. But if they're not essential workers, we ask them to stay home and quarantine. Okay. And the quarantine period is 14 days from the last date of exposure. And so that's kind of the overall picture, and that's mostly done via phone, and usually followed up with some email that contains information for the case or their contacts, as it may be. One thing I wanted to mention is, among other reasons, to interrupt the spread of COVID, obviously us having the fewer number of contacts we have, the less likely we are to come in contact with someone who will infect us. And if we are sick and, as I've mentioned several times, we can be contagious for up to a couple of days prior to feeling ill. And during that time, if we're out there and about, we can spread it to others. So again, the stay home, stay healthy, unless you need to be out of the home, not only does it protect you, but it protects others. And last but certainly not least, the fewer contacts you have, even if you do develop disease, if you do get infected, then that's fewer people that we have to contact and quarantine. And it's not about our work burden, but think about the impact on others who would then need to be quarantined. So just another pitch for trying to keep our world small for the time being as we move ahead. Last, some updates on data and testing moving forward. First, on data. As this pandemic and our local experience with it matures, the the effort made to update the data every day is the same. It's the same amount of work. But the benefit to us as public health officials and to the community becomes, day-to-day changes become marginally significant now. And so in an effort to make most efficient our work, we've been reporting on long-term care facilities every day. And what we're going to do is stop reporting on individual long-term care facilities every day. We're just going to collapse that into a single figure about long-term care facilities. And then once a week, we'll put out a more detailed report about long-term care facilities that will provide you with useful information. And that weekly report will start next week. The other adjustment is we have a bar graph on our daily report that shows the number of people tested and the number of people positive. We get that off of the Washington State Department of Health's website, which any of you are free to go to. If you just Google coronavirus, WA, Gov, and dashboard, you can get to that dashboard and you can look up the same information that we present. But we had been asked to superimpose on those bars the numbers of positives and the numbers of negatives, and it's just optically not feasible to do that. And so we will do a running summary of percent positive and number tested, number positive, and percent positive once a week. Again, rolling forward to keep things efficient and smooth. But if any of you are curious, you can just go to the Washington State Department of Health website and look that up yourselves. Let's see. Last, we had previously reported that we'd be announcing mobile testing for the north end of the county sometime next week. And I want to update you that on Wednesday we did 36 tests. All were negative. And today we only had 15 pre-registered for going to the day for testing today. I'm not sure if that's a systematic decline or just it's a Friday effect. But as we move ahead, we're changing our planning a little bit. The rapid testing machine we had been using for that, its throughput capacity is not very high. We can only get 3 or 4 tests through the machine per hour. And so it's more efficient when we're making an effort to just collect swabs and send them to a lab. So the downside of that is the individuals being tested don't get instant results, but the upside is that more people can be tested. And we think that that's the greater benefit, especially as the turnaround times with the labs has been decreasing lately. For the week of May 11, we will not be having any drive-through testing facility, and instead our team will be developing plans to resume larger drive-through testing operations similar to what we had in Everett last month. So we'll share more details about that next week as those plans evolve. So with that, I'd also like to welcome and turn it over to Dr. Cavanagh to share information about pets, animals, and COVID-19.
Thank you. I know this is a very difficult time for everyone, and I wish the best for everybody. This is an unprecedented time for any of us alive, and I think it's historic. And I think most of us, as we go through it, do not realize, or it's hard to grasp the significance of what we're dealing with on a day-to-day basis. I'm going to kind of overview a little bit just on the coronavirus, just some very basics for people that may not have be tuned in, and then specifically, of course, I'll address animals, and they've been making the news lately. The coronavirus, of course, has been around for a long time, thousands of years, both in the animals and jumps to humans occasionally. And when you see the picture of the coronavirus on the web, it looks like it has lots of orange spikes on it, and it actually, I'm not sure they're orange, but it does have a lot of spikes, and I'm sure Dr. Spitters would agree that's what makes them sticky, and that's one of the things that makes them very hard to get rid of, and it makes them so when you catch it, it stays with you for a while. Of course, those spikes also, when you look on it under electron microscopy, makes it look like a crown, and that's where it gets its name. It was first discovered in the 30s in birds, and I think in the 60s then in people, as one of the common viruses for the common cold. Now, coronavirus has many, many different species of virus that affects many different species of animals, birds, and of course, bats. As we know, this species probably came from the horseshoe bat from China, from caves that are probably 300 miles north of Wuhan. And so they actually aren't from Wuhan itself, the bats, but they feel they were probably being studied in 2 labs there, and that's how at least the current theory makes sense. There have been genetic sequencing of it, and it looks like it's a natural mutation. It doesn't look like it was genetically engineered. I know that's a question that comes up at times. It is a zoonotic disease, meaning that it can go from animals to humans. And of course, that's what's happened recently with COVID-19. I think the first giant outbreak of it was in 2003, and that one came from the civet cats in China. Interestingly, I was reading, and there's thought that the flu epidemic in the late 1800s was a coronavirus. But of course, they didn't have the equipment to identify it then. But it's been around a long, long time. We deal with 2 in dogs. We have a coronavirus that has been around probably for about 20 to 25 years, causes mild GI upsets, diarrhea, vomiting. The severe forms can mimic parvovirus. We do have a test for it, but we rarely do it because it takes 2 weeks to get back, and by that time you've already cured the dog. So, and it usually is a mild GI problem, gastrointestinal problem, and self-limits. In cats, we also have a mild GI form, and that's what most cats get. But interestingly, there is a fatal form of coronavirus in cats called feline infectious peritonitis, and that causes a vasculitis, an inflammation in the blood vessels, when you form an antibody antigen complex that adheres to the blood vessels and causes leakage. I did read recently that they're finding vasculitis syndrome in people now. And I don't know, but I wonder if it's similar to the problem that we have in cats. Most of those cats that come down with it, and it's probably only probably less than 1% of cats that are exposed to coronavirus, come down with FIP, and most of them we feel are immunocompromised. And so it may be similar in people, where immunocompromised people are more susceptible to the severe effects of the coronavirus. The question now, as we read about pets that are testing positive for coronavirus, for the COVID-19, what does it mean? What does it mean just both for the people, and what does it mean for the pets? So the first report of that was the Bengal tigers in the Bronx Zoo. There were 5 tigers. They had a COVID positive feeder, person that was feeding them, and that's where they came in contact with the virus. One tiger was blood tested positive. The other 3 were actually tested positive through the feces. They didn't do blood tests on them because you can imagine drawing blood from a Bengal tiger is not real easy. And to put them through the sedation and just to draw blood, they didn't feel was worth the risk. Now, the cats had very mild transient respiratory infections. That's why they tested them, but that was it. They did not really have serious signs from it. There have also been reports in China and in New York and in various places of pet animals that test positive for COVID-19. There other than one or two of them, they've all been in COVID-19 homes where a person has been infected with COVID-19. And the animals had most of them had mild respiratory signs. There was two of them, a pug in particular, that had no signs at all. I'm not sure why they tested it, other than they had a COVID-19 person in the house. And all of the animals had, if they were symptomatic, had very mild respiratory infection. So what's happening there is that they are in an environment where there's a high level of the virus in the air. As we know, it's transmitted by aerosol. And it gets into the animal's respiratory tract, but it does not replicate, but it can cause mild inflammation, or what I would call a one-pass infection. It causes a mild infection, but doesn't replicate to keep it going or cause a more severe infection. Coronavirus, the COVID, does not replicate in dogs. They've shown that on trials. It can replicate in cats in the lab, but they've never had any clinical signs of it. And so basically, people cannot get COVID-19 from their pets, and they really cannot give COVID-19 to their pets. Of the millions of cases of COVID-19, there's less than 30 documented cases of even any signs from COVID-19 in pets. So you can understand that it's an extremely low number of pets that are even transiently infected. So they're not a mode of transmission, and they aren't at risk of infection from infected people, COVID-19 infected people. But that does not mean that since we love our pets, we don't take extra precautions with them. And what the CDC recommends is that if you have COVID-19 person in a house with animals, that they should take precautions. Now, we don't actually have our pets wear face masks. That we haven't perfected yet. But we do believe in social distancing for our pets. So if you have a COVID-19 infected person, they should not be loving on their pets. And actually, ideally, the pet would not be associated with that person during the time of the infection. That means that the pet should have a separate caretaker. The infected person should not feed the pet, should really not groom the pet, and certainly should not kiss and love and snuggle on the pet like we all like to do. We don't want to do that if you're sick. The other precautions that we take with our pet is that social distancing when you're out and about. So although we don't believe that there can be transmission from pet to pet and from pet to person, I think that in this time, if my adage to my clinic and my clients is, if you think you're being careful enough, you're not doing everything you can. Because one life lost from carelessness is one life too many. And so the recommendation for pets is to keep them on leash when you go outside. And I know Dave mentioned that the dog parks are opening, but I would not recommend taking your dog to a dog park at this time. One thing that is a question is, if you have a pet, can they carry the virus on their hair? So far, it's not been shown to occur, but it is a risk. If a COVID-19 person pet an animal, that dog ran over to somebody else and they pet the animal, could there be transmission? It's a possibility. It's called a fomite transmission. The thing with the virus, like I discussed or mentioned, is it's really sticky and it's hard to come off of the hair once it gets on. But the best advice is when you're around another pet and you've spent time with it, wash your hands like you would just like if you were going anywhere, the grocery store or anything else, and make sure that you avoid contact with other pets and other people. So social distancing with your pets as much as possible is what we would recommend too. Now, people often ask about testing their pets. Their dog or cat has a mild respiratory infection, and of course, all you hear about every day on every channel, every hour is COVID-19. And they're sure that their pet has COVID-19 because it's sneezing or sick. Are there tests available for animals? Well, there are. And actually, there have been thousands of tests done on animals, and only the few that I mentioned have been positive. They do have a test for animals, but veterinarians like myself do not have access to these tests. Anytime we have one dog tested or a cat tested, it has to be approved by the state veterinarian. And there are certain criteria that they have that before they will allow testing of an animal. One of them is that they have to be in a house with a COVID-19 person. They have to show clinical signs of COVID-19, which would be respiratory signs. And they have to have been tested for other more common diseases, which would usually entail what we call a canine respiratory panel or a feline respiratory panel that checks for the common viruses that would cause respiratory infection most of the time. If those criteria are met, then we can test, then in the state approves, then the test can be done. Other than that, we are doing, at my clinic and most clinics, we are not allowing clients into the clinic. We're going out and picking them up. My techs all have PPE on and face masks. They bring them in. We do our consultation over phone. There is telemedicine available. And so we're trying to take care of the animal world as best we can through these trying times. That's a quick synopsis, I know, of what's going on in the animal world, and hopefully it helped. Thank you.
Thank you, Doctor. That was fascinating. Very good. We have some questions for Dr. Spitters. Is anybody at the health department monitoring any new cases tied to the Snohomish barber?
No, not at this time. No.
How many people does the health district currently have to do contact tracing, and how many people will be provided by the state once the people being brought on to do this work are trained?
Right. So our current capacity is almost 10 full-time equivalents. It's about 15 people total, but some of whom are working on this full-time and others who have been reassigned from other areas. And then we're in the process of training some temporary employees and some medical Reserve Corps volunteers to take our FTEs, full-time equivalents, that's, one full person, up to, the goal is to get up around 30 total staff able to work on COVID-19 investigations. And with that, we believe we'll be able to handle current case loads just fine in-house. And then, but if we're not able to, or if caseload increases and it gets beyond our capacity, then that's when we'll work with the state to have them do some of our investigations. So when you, I think the specific question was, how many will be provided by the state? The state has their army of contact investigators, some of whom are National Guard Reserve, and they're going to be working with and for all 39 counties. And our use of that labor pool will depend upon our demand. And so I can't give you a specific number, but in general, the state's always been there to handle the excess that we could not handle in-house. And that's the plan going forward.
Great, thank you. And there's a question about what do you say to parents with kids, teens who have been stuck at home for 2 months and want to see even one friend in person? Is this allowed? And I got to say, I know we have a 93-year-old mother-in-law who's been in her home for the duration and doing well, but she's getting antsy and family members are getting antsy, but we're saying it's too early, and I hope that's consistent, Dr. Spitters, with what you'd recommend.
By all means, Executive Summers, this is painful. This is a manifestation of the social costs of the social distancing, and it's not easy and tough on kids and tough on their parents. And yet, if we were to just permit what seems to be one innocuous reunion between two friends, now we've taken, let's say you have two households of 4, now we've made that a group of 8. And so that has sort of a logarithmic or exponential impact on the risk of disease transmission, because when those two kids get together, you're really bringing together both of their households. And so as painful as it is, and I hate to be, the stick in the mud about it, but we really do need families to maintain this distancing, notwithstanding the kind of hardship that this question brings up.
And Dr. Spitters, do you want to provide a little bit more detail about what the future testing sites will look like? How long they'll be set up?
I wish I could, but that's why we're planning them. I don't have the information to share. I can't even say for sure whether it would be drive-through or a fixed site, although we're leaning toward drive-through. But we're just going to be working on that in the days to come. Early mid next week, we should have more info. I would think by next Friday's briefing, we should be able to give you some sites and capacity, and hopefully some even some like websites where the typical link where someone would go in and register. But for right now, I don't have any specific or detailed information to share.
So there was the last question that I'll respond to, and it's regarding, yes, I'll respond to Hannah Scott's question, that there's been a letter by some mayors that seem to diverge somewhat from the message that I've sent and all the mayors in the county. So I very much support the governor's phased approach. It's thoughtful. There's science behind it. It's got the support of the public health officials, both locally and at the state level, consistent with CDC guidelines. And so very much support that. But just as there is in the public, there's varying opinions about how fast it should go. And I think the letter by some mayors that you refer to reflects that diversity of opinion. I've got check-ins with all the mayors. Now we're twice a week, but we're trying very much to convey information and keep us together. But again, mayors are a diverse bunch, and they have a right to express an opinion. But as much as we can, I'm trying to coordinate that so that we're not overloading the governor's office with various opinions and pressure to do one thing or another. So again, I very much support the governor's phased approach. I think it's the best path forward through a difficult course with conflicting needs for protecting lives and public health concerns, and on the other side, the economic impacts that this virus has had. It's a difficult path, but I very much support that phased approach.
Well, thank you all for joining us. This is Carrie from the Joint Information Center. We'll go ahead and wrap up, and please stay tuned for future media availabilities. Thank you.